All right, this one right here goes out to the ladies and those who support the ladies. There's no way around it. It's time to talk about vaginas. More specifically, vaginas dealing with endometriosis. Periods can feel so awkward to talk about, and endometriosis, which affects periods, is talked about even less often. This week on Sexual Revelation, we're saying no more. In this video, we're explaining what endometriosis is, what to do if you have it, and how to support someone you know if this is what they're dealing with. Talking about periods makes a lot of people cringe, but that's only because we haven't normalized the conversation yet. So for many of us, it could feel like endometriosis is not a big deal. That's simply not true. What's even worse is that because endometriosis is not commonly talked about, many women end up suffering for a long time, sometimes too long. Endometriosis is the growth of uterine-lining tissue outside of the uterus. This tissue spreads, covering the ovaries and the lining of your pelvis. With this tissue growing outside of its designated place, women experiencing endometriosis can and often do suffer from a series of symptoms. Some of the most common symptoms are intense abdominal pains, cramping, and incredibly heavy periods, and even infertility. Historically, it used to be very difficult for women suffering from endometriosis to be taken seriously. Their pain was passed off as normal period pain and not given the attention it deserved. Instead, many women would have to deal with endometriosis in silence, which can have a high cost. So, how can you know if you're suffering from endometriosis? And what can you do to alleviate the pain? Don't worry, Sexual Revelation has you covered. Before you can treat endometriosis, it's really important to know that it's what you're dealing with. Issue is, for many, it can be somewhat difficult to tell if you're dealing with endometriosis or normal menstrual pains. With a normal period flow, the average period may last about 3 to 5 days. Of course, there are some people that may have their period for shorter or longer, but in general average, it's 3 to 5 days. The flow typically begins heavy and lightens up as the days go on, which can also vary for some women. But if you're suffering from endometriosis, you may be experiencing bleeding during and between your periods. Your period flow may be much heavier than it should be, having you go through several pads, tampons, cups, and panties in a day. With endometriosis, often comes severe pains during your period, rendering you unable to move through life as you normally would. Along with intense cramping can be severe migraines and lower back pain, stronger than normal. If these symptoms sound familiar to you or about someone you know, it's important to seek out a doctor for confirmation and help. Doctors can run proper tests to find out if you're dealing with endometriosis. It's equally important not to wait. For one, the pain will not go away on its own, but instead get worse. Secondly, if left without treatment, endometriosis can spread, worsen, and lead to infertility. There's no cure for endometriosis, but there are treatments that can help lower their amount of discomfort and pain. Some of the most common treatment options are pain relievers, hormone balancing, and surgery. Pain relievers work for some women, especially those dealing with a milder symptom. We aren't talking your basic Tylenol. Instead, stronger working drugs like opioids and non-steroidal anti-inflammatory drugs can help the pain subside. Hormone therapy is another option some choose to take. Since hormones cause endometriosis to go through a cycle similar to the menstrual cycle, hormone therapy can be an effective treatment for pain management. Hormone therapy can be dispensed in the form of a pill, nasal spray, or an injection. Check out the link below on different types of common hormone therapy. Surgical therapy has been shown to show real but short-term pain relief for endometriosis. Many healthcare professionals would only recommend the surgical route for those women dealing with really severe pain. During the surgery, the surgeon will be looking to locate the tissue growths caused by endometriosis, analyze the size, and remove the growth patches. It's very important, though, to speak at length with your doctor about the procedure and its potential risks before going ahead with this option. Endometriosis is real and is affecting many women. Don't allow yourself to feel ashamed if you're suffering from endometriosis. Instead, look after yourself, find a doctor who will help and alleviate the pain. Don't suffer in silence. Sexual Revelation is here to provide you with sexual health information, as well as fun products and tips to try at home, your bathroom, or your car. Thank you for watching this episode of Sexual Revelation. Don't forget to subscribe. If you want more in-depth information on endometriosis, check out the link to our blog page below. And don't forget to follow us on Instagram to get updates on new videos, products, and much, much more. Bye!